Hi, I'm Smita Mehra, the Principal Dentist at the Neem Tree. Today we're going to talk about wisdom teeth and wisdom tooth extraction. Because your wisdom teeth are the last to emerge, there may not always be room for them alongside your other adult teeth. This may mean that the wisdom teeth erupt at an angle, which makes them difficult to clean or not even at all. The buildup of bacteria and plaque that can result from impacted wisdom teeth can ultimately cause more serious problems such as tooth decay and gum disease of the adjacent teeth. If your wisdom teeth are causing you pain, your dentist may decide that the best solution is to remove one or all of them. Wisdom teeth are not necessary for chewing food, and removal of them is one of the most frequently carried out oral surgical procedures. Before your wisdom tooth extraction, your mouth will be x-rayed to give your Neem Tree dentist a clear picture of the position of your teeth, including the roots. You will be given a local anaesthetic injection, and if you are nervous about the procedure, we can also help with sedation options to relax you. The procedure needed to remove your wisdom tooth depends on the position and the angle of your teeth, making each extraction different. Wisdom tooth extraction typically takes around 20 minutes, but it can take longer or shorter. Afterwards, some swelling, bruising and stiffness of the jaw is normal, but shop-bought painkillers should be sufficient to manage any pain that you would experience. To minimise recovery time and reduce the chances of complications, it is important to stick to the strict post-surgical care routine advised by your dentist. This will include eating soft foods for the first few days and avoiding rinsing your mouth out for the first day to prevent damage to the blood clot that will form in the socket of the removed tooth. Some frequently asked questions about wisdom teeth are as follows. What are wisdom teeth? Most adults have along the way experienced wisdom tooth problems. This is usually because of the eruption pain that occurs when they are coming through, much like teething in children. However, wisdom teeth are very unique in that they can have abnormal shape, root formation and eruption position. Quite commonly, these teeth can become impacted, which is the technical term for being stuck behind the teeth in front. This is because the angulation they decide to erupt can become somewhat unpredictable. If they erupt and cause pain, it is usually the soft tissue, gum around the tooth, which becomes inflamed and a trap for food. This can cause further inflammation and swelling around the gum. This is a term called pericoronitis. The opposing wisdom tooth can then bite down on the gum already inflamed, causing further swelling, and a cycle of recurrent inflammation and infection occurs. Most of the time, this can be treated with good oral hygiene, cleaning the area well, either with an electric toothbrush or professionally with a dentist or hygienist. If this persists and the swelling and infection worsens, it can result in pain, facial swelling, temperatures and a limited mouth opening. When should I have them removed? They should only be removed when necessary. Guidelines created by the National Institute of Clinical Excellence, or NICE, have provided certain situations where they should be removed, which is based on the most relevant and up-to-date clinical research. Situations where there is decay in the wisdom tooth, decay in the tooth adjacent, several infections requiring 3 or more courses of antibiotics, or one severe infection are just some of the indications for removal of wisdom teeth. Ultimately, removing them must provide you with some benefit, and this should be weighed up against the risks. What are the risks? Whenever we treat patients, there must be a benefit, which must outweigh the risks. The main risks are pain, swelling, bleeding, infection, stitches, damage to the adjacent teeth, and retaining roots. There is also a nerve which is in close proximity to the lower wisdom teeth, which can be susceptible to damage. This risk can vary from person to person and often depends on how close the nerve is to the wisdom tooth. This must be imaged with a special form of imaging known as an OPG, or an orthopantomogram, or a dental panoramic tomogram. And nowadays, a 3D scanning with a CBCT cone beam computerized tomography is also common practice. Whilst the risk of nerve damage is generally quite low, if nerve damage does occur, there can be persistent numbness, pain or altered sensation of the lip, chin and tongue, which may or may not recover. This is why it is important to be seen and treated by a suitably trained clinician to assess, diagnose and treat you accordingly. If you have any further questions, please don't hesitate to contact us, and thank you for watching.